So good afternoon, everyone. Welcome to our webinar today. I'm Gina Kanaynay, Career Manager in MSF Hong Kong, and I am very pleased to be moderating this live discussion with Médecins Sans Frontières, MSF, or Doctors Without Borders, for the second webinar of our Overshadowed by COVID-19, Neglected Diseases in the Spotlight series. This webinar, titled Measles, Resurgence of a Preventable Disease, is about a highly infectious disease that is preventable through immunization activities. As COVID-19 puts the world on pause, health programs for various preventable diseases have also been severely disrupted. Here, I'd like to share some of the house rules. Participants, other than the speakers, are muted. Questions may be asked throughout the webinar, sending your questions by typing in the Q&A box on the bottom of your screen. We will have a Q&A session at the end of the discussion, and we will respond to your questions accordingly. We will be recording this webinar for future viewing. This live discussion is organized by Médecins Sans Frontières, MSF, an international medical humanitarian organization that provides free, quality medical assistance in over 70 countries to people affected by armed conflicts, epidemics, natural disasters, and exclusion from healthcare. Here is a short video briefly introducing our work.
I don't see what she's wearing.
How he earns money.
What phone he has.
I don't see who she prays to.
That she's a threat.
Which border they cross.
I don't see if he's a soldier.
If he's a refugee,
Which side they are on.
I just see a child. A human being.
A patient. Doctors Without Borders.
Independent.
neutral,
Impartial.
I'd like to introduce our three speakers today. Firstly, joining us from Geneva is Dr. Natasha Crowcroft. She is the Senior Technical Advisor for Measles and Rubella, World Health Organization. Dr. Crowcroft conducted technical work for WHO on vaccine-preventable diseases and has been working on measles and rubella elimination for a decade. Welcome, Dr. Crowcroft. Next, we have Dr. Choi Kin Wing joining us from Hong Kong. Dr. Choi is a specialist in infectious disease at CUHK Medical Center, a teaching hospital owned by the Chinese University of Hong Kong. He is also an academic title as a clinical associate professor honorary in Faculty of Medicine of the Chinese University of Hong Kong. Formerly, he has advised for Center of Health Protection. Hi, Dr. Choi. And finally, we have Ms. Amy Hapitana, who's joining us from the Philippines. She's currently the Nurse Activity Manager of an MSF project in Marawi. Amy has over 20 years of experience in humanitarian sector. In 2019 to 2020, she was the project medical referent at an MSF mother and child hospital in Bangladesh, where she was involved in measles response for the refugee population. Again, welcome to all of you to join the session, Measles, Resurgence of Preventable Disease. I'd like to start today's session by refreshing our impression on measles. First, attendees, you now should see a poll on your screen. So kindly answer the poll. Yeah, and hit submit. Okay, so basically for the question, do you know how many people can be infected by measles? So, all right, now I see it. So, okay, so actually the answers were quite almost the same. So basically, measles actually can be infected. For one person, you can infect 18 people. So it's a very highly contagious disease. In some places in Southeast Asian region, measles isn't an unfamiliar disease for us. Measles vaccination is even part of the routine vaccination program of the country. I'd like to start this discussion by asking our speakers, why do we still say that it is neglected? Yes, Dr. Crowcroft.
Thanks very much. So I think there are maybe three main reasons why measles could be considered neglected. And the first one is people don't realize how severe it can be. It's people take it for granted. They think, oh, it's measles, but they don't realize that actually, I mean, for example, in 2019, more than 200,000 children died from measles. It can be very severe. About 15% of people who get measles have a severe complication. About 9% get pneumonia. There are long-term effects of it, brain damage, deafness. I used to work with somebody who was deaf in 1 year because she had measles as a child. So people don't realize how severe it is. And part of the reason for that is the second reason it's neglected is because it's so familiar to everyone. You know, it's just measles. They don't understand that it isn't just measles. It's a huge, huge killer. And then the current reason that's really a problem is COVID, of course. You know, we have an issue with getting an interest in measles because everybody is occupied with COVID. So those are three reasons I would give. I'm sure my colleagues would have others, but you know, those of us who've seen what measles can do realize this is not a disease we can take for granted, and we have this magical prevention. We have a vaccine that's incredibly effective and incredibly safe. So we can prevent this disease. We just need to vaccinate kids.
Well, that's very true, and I guess Amy here can also share her part of her experience while working with MSF as well.
Thank you, G. So yeah, exactly. Measles is still a neglected disease because, like, for some countries that we work, the routine immunization program is still weak. So we've seen, like, in some countries where you have demotivated staff, they have low salaries, and then also there's an issue with the cold chain, and also there is no enough manpower. Also, to add to that, there is a problem with the accessibility. So in areas where we are working, it's very isolated, where people need to walk hours to reach a healthcare facility. And there are some people also who cannot afford the cost of transportation going to the healthcare facilities. Some projects where we work, they are living in a high conflict areas or a remote rural locations. And to add to that, there's the poor knowledge of community towards vaccination, which can lead to misconception and misinformation.
Yes, definitely. I couldn't agree more with regards to the access as well to these vaccines. I remember very well when I was working as a nurse in Central African Republic, we had a measles outbreak there. And actually, we were treating patients just by their symptoms, fever, diarrhea, respiratory problems. And because there is no specific treatment for measles just yet. So the prevention is the key to combat measles. I'd like to ask Dr. Choi, what is the safe, effective, and inexpensive method to do it?
Yes, thanks for the questions, G. And I think the answer is pretty obvious, which is the vaccine. And we have the vaccines for decades already, and it's been proven to be highly effective. For one dose of vaccine, we can offer about 93% of efficiency in terms of the protection from clinical diseases. And if one can complete a 2-dose series, the protection could be up to 97%. And also the long-term effect of this vaccine protection is well demonstrated from various studies. On the other hand, because of this disease is highly contagious, if we really want to achieve the herd immunity, that is, we want to protect those who couldn't be immunized through the vaccination of other people that can receive the vaccination, we need to achieve at around 95% in terms of the population level of vaccination before we can achieve the herd immunity. So it's a big challenge for us, actually.
Yes, I guess that's very true. And, you know, with the current situation as well with COVID, and I mean, we are now facing that kind of gap actually for making sure that we get this, or we reach at least this percentage of population being vaccinated. I don't know if Dr. Crowcroft or Amy would like to supplement.
Okay, maybe just to add, like what I said, in MSF where we work, our medical activities is always complemented with health promotion activities as well. So the HP activities mainly focuses on providing information to the population about certain diseases and how they can protect their family and community. And part of the health promotion activities that we do also is to continue the surveillance. And if there is an outbreak of a certain diseases, like in the IDP and refugee camps, we also tailored our health promotion activities based on the diseases that we saw from our facilities and also in the communities. So aside from the usual topics that we normally do in the routine work in the community. So last year, there was an outbreak of measles in some refugee camps in Bangladesh, and we supported in the community mobilization and sensitization in the camp. So this is to actively inform the population that there is an outbreak of measles, what they should do, and for us to provide the information about the ongoing campaign that the different stakeholders that is going to organize, and lastly, to address also the misconceptions that they have related to the vaccines.
I guess the misconception will always is always present, right? In issues concerning vaccines, and it's something that we really need to work on, giving all these health promotion and information. So now it's time for another poll. Attendees, you will be seeing another question: which group is the most vulnerable? So the choices are the elderly, unvaccinated, immunocompromised children under 5, and people who has hypertension. So 96% of our guests here were able to answer. So the most vulnerable population, vulnerable to measles, are actually the under-immunized children, especially under 5. They are the most at risk in contracting measles, especially children under 5. 15% actually is infected with measles, can get complications such as pneumonia, seizures, and encephalitis. These can cause deafness, blindness, and brain damage as well. Amy here has worked a lot in projects with MSF in low-resource settings, such as refugee camps. She mentioned it earlier. For settings like this, it can be very fatal, especially for children under 5. Why is that?
Okay, so our experience working in the refugee camp, especially in Bangladesh, during the outbreak of measles was very challenging. In the refugee camp settings, as everybody know, refugees have limited movement, and also they have poor understanding on different health issues, including the importance of having their children vaccinated. So there is also some misconceptions towards the vaccines, that the family believe that if they will bring their children for vaccination, the child will die or will get sicker. So we started to see cases of measles in our hospital, like somewhere in December 2019, and then we saw a surge of cases referred to our hospital in January. So we had an increase of referrals from different INGOs and other healthcare facilities. There's also an increase in admission of our intensive care units in the pediatric ward, where like 38% of deaths in our hospital was related to measles. So the problem also that we saw, that from those cases that we received from our hospital, several of them admitted was already on severe and with complications like pneumonia or respiratory failure. The measles vaccination campaign was delayed also due to several reasons. Like, working in the camps, there are a lot of stakeholders, there's a lot of actors. So from the beginning, it's there's a delay. Why? Okay, who is going to lead? Too many stakeholders working in the camp, which is a challenge also to coordinate. So we as MSF, of course, strongly advocate to speed up the vaccination process because since we were overwhelmed already with the number of cases in our hospital, and our capacity to accommodate was already reaching our limit.
That's true. I can only imagine the context in refugee camps, especially in Bangladesh, wherein we have actually one of the biggest refugee camps. Dr. Crowcroft, why can this be very fatal for children under 5?
So it's actually, one of the reasons is that it's the biology of the virus. It attacks young children, especially babies. So they get really sick, and they're obviously, everyone knows that infants are the most vulnerable in lots of ways. So if they get pneumonia, then it's very, very dangerous for them. But they're also more vulnerable to a feature of measles, which is encephalitis, which is where you get brain swelling, brain infection. So, I mean, they're more vulnerable to every bad outcome. If they get diarrhea from measles, a baby can get very sick and die very quickly, especially if they have other issues like malnutrition, which is obviously, in this kind of setting is really, an important feature. There was one thing I wanted to say in relation to, and Amy was, describing really eloquently the situation that she was facing. One really positive thing about MSF is the credibility that the organisation has, and the people who work in MSF and healthcare providers in general have such credibility with people. So when you talk about everyone's hesitancy in getting vaccinated and their concerns and their fears, that usually if they're being reassured by their own healthcare provider or someone from an organisation that they trust, like MSF, then they're much more likely to listen than if it's, a government spokesman that they don't know. So that's one area in terms of the hesitancy challenge, and in also when it comes to getting parents, giving them the message to bring your children forward quickly for care when they do get sick, to give them the basic care you can give, which isn't, we don't have a treatment for measles, but there's lots of supportive care that can be given. It's really important to have good healthcare workers who are positive and encouraging for parents, and they're really highly trusted. So just to make that comment and to amplify really what Amy was saying. Thank you.
Yeah, thank you so much, Dr. Crowcroft. And apart from vulnerable context, we have even seen small outbreaks of measles in some places where healthcare systems are even well functioning. Take, for example, the 2019 outbreak in Hong Kong International Airport. Also in 2019, there were 870,000 cases of measles reported, one of the highest number in nearly a quarter of a century. And as what Dr. Crowcroft mentioned earlier, nearly 208,000 deaths. What do you think contributed to that, and why maintaining routine immunization and supplementary campaigns can make a difference? Maybe we can start with Dr. Choi.
As you said, in Hong Kong, we face an outbreak, which actually happened in the international airport. It involved some 60 cases at that time. And for your information, in Hong Kong, we actually have a rather comprehensive child vaccination program, for which measles is one of the items to be covered. Yet, in the past 10 years or so, we saw cases of measles mainly from the expatriate and also from the travelers. And that's the reason why the airport is one of the hotspots for the outbreak to happen. And the other cases that we came across throughout the years are mainly those of the foreigners coming to Hong Kong for travel or for work. So in fact, in Hong Kong, about 40% of the citizens are not born in Hong Kong. So they are also one of the sort of hotspot in the development of the measles. And as we said, measles is a neglected disease, but it's not just happened in those marginalized population. Even in the developed countries and cities like Hong Kong, we also facing with the trouble. People actually, I would say is we are suffering from the success of the vaccination campaign. People are seeing less and less cases of measles. So they forget about the importance of measles and just take it lightheartedly, I would say. And also nowadays we are now in the digital era for the social media. And sometimes those falsified informations, especially for those of anti-vax propaganda, has actually a very, very large negative impact in terms of the measles prevention as well.
Yes, I couldn't agree more. In countries where they already at least reach, the percentage of having everyone vaccinated with measles, they tend to forget. Maybe Dr. Krokov can also have a share in terms of how WHO sees this.
It's true that measles outbreaks can happen anywhere, and it goes back to the fact that measles is so infectious that you need, and that means you need, as we heard earlier, very high vaccination coverage. So really immunity of 95%. So it's very hard to reach anywhere, even in a good program. But when you have people moving around, people moving in and out of countries, it does show how even if you have a good system, it needs to reach everybody. And if you have communities that arrive and leave, then it's quite hard to reach people. You need very good people running your immunization program to catch communities that can be missed by even in a strong system. One of the interesting things about COVID is that we're not seeing as much measles for a number of reasons. One of which is that our reporting systems are not as good right now because they're diverted into, our laboratories are testing for COVID, not for measles. But one of the reasons seems to be also the reduction in travel. So that people traveling around, they see the infection. So you have a community that has a small gap in immunity that wouldn't be a problem until somebody arrives from outside with measles, or actually more commonly, someone from that community travels abroad and then brings measles back as a holiday souvenir, as it were, and then spreads it to the community. So it's a huge issue, and it requires really thoughtful people working in the public health system to understand their communities and where they're going and where they're coming from and where the movements are, and in order to reach them.
Right. And since you just mentioned, the resurgence of measles still brings a lot of risk in public health for developed and undeveloped countries alike. How do health organizations and practitioners respond to this obstacle?
Right. So the health organizations, I think, having good information and understanding is really important, and having good data, which is a huge challenge in low and middle income countries, to know who's been vaccinated and where they are. Having good parent health records, for example, can be really, really difficult to achieve in some settings. So that's one sort of bedrock of understanding whether you're reaching your communities effectively. And so that's something that really governments need to support and enable to happen. And then the other thing that needs to happen is governments need to be prepared to react really quickly when an outbreak starts, because the sooner you respond, the sooner you can get it under control. So that's a whole amount of work to prepare and be ready, and that requires healthcare providers to report when they see a case really quickly, laboratories to report really quickly, and the public health system to respond and to figure out where they need to vaccinate to contain an outbreak. And then the other thing in terms of prevention is where a community does look like it hasn't got high enough immunization coverage, then action needs to be taken to fill those gaps. Sometimes that's a matter of going in and finding people who weren't vaccinated, and sometimes, which is, for example, in a refugee type setting or somewhere where you have a community where you think everybody's probably at risk because of the situation that you're in, you have to vaccinate all the children there. And that's the most efficient and effective thing to do. So you do a widespread campaign. Sometimes you need a national campaign, because if immunization coverage is very low, then you just vaccinate everybody who's in the age group. So there's various strategies that are used to try and prevent outbreaks, but really quick response is important. And then the final bit, which people often forget, is if you have, when you do respond to an outbreak, you don't at the end of it all, or at the end of a campaign, then just walk away and forget about it. At that point, you have to stop and say, well, why did this happen? Why do we have this big gap? Why do we have low coverage? Why is this community being missed out? Or which community was missed out? And what can we do about it? Is this a group that's really hesitant? Is there an issue? Do we need to go and speak to community leaders? Do we need to get other people involved? So I think there's lots of different things that can be done, but that piece of stopping and reflecting on what happened and then trying to fix things going forward is really, really important to prevent it just being an ongoing cycle.
Yes, I can totally relate to that. I mean, with outbreaks, we can never only put like band-aids on this one. Instead, we really need to look into what we can do further on to actually avoid such outbreaks. And I wonder for Dr. Choi, after that experience in 2019, what has Hong Kong Ministry of Health has done so far?
That actually is very important. And in fact, understanding the local epidemiology will help a lot in terms of the devising of specific programs. Just like in Hong Kong, we have a large population of foreign domestic helpers, including the Indonesian, Filipino, and so on. So in past few years, we make focused programs of education. We try to reach out to the patients that they meet and try to give them education and also to promote the vaccination for them as a part of the effort in curtailing the incidence of the measles among the domestic helpers and the expatriate as a whole. So this is just an example. So understanding local epidemiology, I would say, is one of the very important.
Thank you so much, Dr. Choi. And so let's go back to the theme of this webinar series to address the overshadowed by COVID-19 issue. Do you think that the pandemic brings an even larger immunization gap across the world? And when COVID response becomes the top priority, what would happen to the regular medical activities?
So I can speak from the global perspective that we're trying to put strategies in place to bolster countries that are struggling the most or where we think there's the highest risk. So we have a strategy that that's trying to help countries build their capacity in this current context, specifically for measles. One of the challenges we have is getting that funded. So there is a funding gap on that. Like with everyone, there's an issue there. So we're still seeking funding to be able to fully implement it, but we're making progress in trying to support countries to be ready and to respond and to build things. But it is an ongoing challenge.
That's so true with COVID-19. I think all the other communicable diseases were actually forgotten. We lost focus. How about Dr. Choi? What did Hong Kong face, or what were the challenges that we faced, especially with the infectious disease department?
Obviously, we are facing a kind of a threat and also a tremendous pressure amidst the COVID-19 outbreak, both in terms of the hardware, like the isolation facilities, the need of the personal protective equipment, in particular the particular respirator, which is essential for the airborne infections. And of course, our colleagues working in the isolation unit are really facing up with the threat of fatigue. And this is in fact one of the major threats that I can foresee in the near future, because the COVID-19 outbreak has been there for almost some 1.5 years by now. So people start to kind of becoming tired, even if they are highly committed personnel for the infectious diseases. So this is one of the threats that we are facing with. And luckily, during this period of time, the measles in Hong Kong is actually at a pretty low level. So we can still focus on the COVID-19. But as you said, many of those other communicable diseases are being forgotten during this period of time. So this is another trouble.
I can imagine for Hong Kong, and how much more for those who are living in refugee camps or in our projects in MSF. I'd like to know what were the challenges, because you mentioned earlier you had outbreak of measles plus COVID last year, and I think at last year COVID already started. How was that experience?
I think the good thing that during the outbreak of measles, it happened in January. And then in Bangladesh, we have the lockdown in March. So it gives us a bit of time to really how to prepare the intervention. So the good thing was that in February, there was a measles vaccination campaign, which really contributes to the reduction of the cases. So meaning, the number of cases that we saw in the hospital was reduced. And then, of course, when the pandemic started and the lockdown happened in March, knowing that we are running a referral hospital where most of the pediatric cases were referred to us. So we really need to balance between running the regular activities plus also doing the intervention for COVID. It's really challenging because the first thing is that our staff was also scared about COVID. So we really need to attend to them first, to address their questions, to make them feel comfortable. And then also we face some challenges where some of them already got infected, and that contributes as well to balance between, again, running the COVID intervention plus running the hospital where we don't have enough staff. We started to have a low number of staff coming to work because they're infected or exposed. So what we did, we normally have a regular meeting in the project and in the operations on how we can balance to run both the regular activities and the intervention for COVID. Also, what we did in the community level is we continue to deploy our health promotion teams to still provide information to the community that our health services are still open, like our OPD clinics are running. They can still have access to the care that they need. Also, our hospitals, it's still up and running. Because our experience with regards to the refugees, knowing that they have limited movement, they have a lot of, like, again, misconceptions about COVID, plus other health beliefs that when they get sick, they don't need to see a doctor. They think that COVID, when they go to the hospital, they will get COVID there. So we really try to promote this kind of information in the community. By what we did last year was also to provide a kind of tour to our facilities to build some trust with different stakeholders, for them to also have a picture that, okay, they don't need to fear about COVID. They still need to encourage people to come to the clinics or the hospital. So, I mean, it's very challenging, but I think what is important that we shouldn't forget that running a regular program is still very important for this population.
Thank you so much, Amy. I can really sense that, coming from all three speakers, you would really see different challenges or even the same challenges, even in different sectors, global perspective. I'd like to, since Amy already mentioned on how they adjusted their medical activities during COVID, in reality, I'd like to ask Dr. Crowcroft or maybe Dr. Choi, with these challenges, in reality, what can be done to improve the current situation?
Maybe if I start. So, and I really appreciate what Amy just was saying. I think one thing that I wanted to flag is that the current situation is challenging, obviously, and both for healthcare providers and for communities. The worry is that things may, for measles, get worse because all the reasons we've said about it being a neglected disease, but we know immunization coverage, routine coverage, the proportion of people we're reaching with immunization has actually fallen for the first time in over a decade in our latest figures. So we're going backwards on our routine programs globally in many countries. We also know the economic impact's very hard on countries. And we know that malnutrition is soaring, which all of this is a perfect storm for big outbreaks of measles coming. And so we need to take action. And, we're talking here I'm sure many of our listeners are very interested in this topic, and we're sort of speaking to people already aware. I think reaching our political leaders is going to be really important because we need communities on side, we need health workers on side, but above all, we need governments to realize they can't just throw everything at COVID. that they can't be trying to solve one problem and creating another one. Measles will kill many more children than COVID. And not to say that COVID isn't a problem for children, but measles will kill many more. And I'm reminded of what happened in the Ebola outbreak in West Africa, where the whole immunization program was disrupted. And the estimates were similar, that many more children were going to die from measles than had died from Ebola. And so a large campaign had to be conducted to prevent a massive measles outbreak. We're now in that situation at a global level, but unlike Ebola, measles does not get the profile. It doesn't get the attention and excitement and motivation. Not excitement in a good way, but everyone's scared of Ebola. Nobody's scared of measles, and so we really need to get our leaders on side and thinking about what are we going to do to prevent things getting a lot worse in the coming years. Sorry to be the voice of doom, but it's something that really keeps me up at night and makes me worried about many countries where I think we're heading towards a really, really difficult situation.
Thank you so much for emphasizing that, Dr. Crowcroft. It's very essential that we do understand the severity or what's happening with COVID, but on the other hand, we also need to be aware of the other diseases and surrounding COVID-19. Dr. Choi, do you have other sharing for this one from your perspective?
Yeah, I agree very much from the comment by Dr. Crawford, and we really need a kind of a top-down approach and a commitment from the government officials in the control of the measles. And in fact, we also need the international collaborations, because infections basically has no boundaries. And even if we can have a very good vaccination program in those developed countries, just a traveler can create an outbreak in those areas. So the international collaborations and concerted effort is essential in order to control the measles outbreak.
Thank you so much, Dr. Choi. And so now we go to our Q&A session. So I guess there are those who has already submitted their questions. I'm going to read one for you. So the question is from Cheng Yang. Does immune evasion of vaccination play a role in measles reemergence? And can we use the measles experience on COVID-19? Who wants to answer? Dr. Crowcroft?
I'm happy to make a start, yeah. This is a really interesting question, and it's come up with many different vaccines, but we have really good evidence that there's no problem of immune evasion when it comes to measles vaccine. It seems that we're really lucky. It's not like we discussed a lot with COVID, the idea that the vaccine, maybe the virus can get around the vaccine. It does not seem to be an issue with measles. And we've now given measles vaccine for decades, millions and millions and millions of doses, never been an issue. So that's the answer to that is no. But I think the second part of the question about can we use the measles experience in COVID? I think COVID experience has the COVID rollout is being really conducted by people working in immunization who have been, measles is a core part of everything we understand, those of us who work in immunization. And so I think it is being used. The slight difference is the COVID focus for the vaccination rollout has really been on adults more than children, whereas the measles focus is really on children. So it's a slightly different approach, but that's also evolving. And I think I'm hoping actually the COVID experience and the importance that vaccination is getting now globally will help us bolster the importance of vaccines more generally, not just measles, but understanding how much we have to understand about communities and how we have to think about vaccines for the whole of life. It's not actually just about children. It's about protecting the health of communities against all vaccine-preventable diseases. So hopefully that was a quick enough answer. But Dr. Choi, you may have something to add. Thank you.
Well, I agree with Dr. Crawford. And in fact, for the measles, it's a problem of access and awareness rather than the immune evasion that matters. But then for the COVID experience, it still helps, I would say, in terms of the international collaborations, the rapidity of development of vaccine and how to deliver the vaccines to the other countries, in particular, those sort of marginalized population will be kind of a model for us to adopt in the future for other sort of emerging infections, and also the re-emerging infections as well. And certainly measles will be one of those.
Thank you, Dr. Choi. We have another question here. So it's from Andy Permana. What are the concerns in managing measles based on the world's current situation?
So I think with the pandemic that is making everybody busy, of course, the attention towards the other programs like the routine vaccination was, I think, hampered already with the pandemic. So I think the problem that we will be facing is with regards to how we mobilize people, and at the same time also the availability of vaccines. So there are some that like in Bangladesh also, even before the pandemic, we were limited only to provide some vaccinations in some of the days. And that is already a concern for us because, I mean, we are running the OPD clinics 5 days a week, and the vaccinations was only limited to some days. And plus, of course, with the pandemic, where people are afraid to come to the facilities because of fear that they will get infected, and especially again for refugees that they have limited movement. So I think if routine vaccinations, not only measles is hampered, I mean, we will see the outbreak again of not only measles, but I think for other diseases as well.
Thank you, Aimee. Another question here, maybe for Dr. Choi. Should all people born outside Hong Kong and now stays at Hong Kong get vaccinated? And any other policies to control measles?
Well, in Hong Kong, we actually have recommendations from the scientific committee about the vaccination of adults. And in fact, for those non-immune adult populations, we recommend them to have the vaccinations. So that's one of the sort of direction from top down, right? And apart from the promotion of the vaccinations, we are trying to make use of the social media actually nowadays to promote the knowledge about the measles in terms of its highly contagious features, the clinical presentations, and also the potential adverse sequelae, in particular for those young child. So we want to kind of increase the awareness of the other group of people, in particular those foreigners and expatriates. And bearing in mind that the foreign domestic helper is one of the large populations of foreigners in Hong Kong, we have a specialized program to help them to understand the nature of measles and also to guide them for the testing of the immunity and vaccination as appropriate. So these are some of the things that we are doing in this locality.
Thank you, Dr. Choi. There's another question here. Which regions or countries are seeing increases or signs of worry for those who work versus measles?
So there's two parts to this. I think the worry part is everywhere. We're worried everywhere because of disruption to immunization programs. So, measles can happen anywhere. Measles outbreaks have happened everywhere. And we saw that 2019, we had outbreaks absolutely everywhere. The places where we're already seeing outbreaks, they're concentrated probably most in the African region and in the Eastern Mediterranean region. Those are WHO regions, but where coverage is, where immunization levels are actually lower, and that's the main reason. So we are seeing countries that are having outbreaks right now and having to do outbreak response, or countries that are teetering on the edge of outbreaks where we're having to go in and do big campaigns. And that's, as I said, that's concentrated in really two main regions. And one thing to mention about that is when you look at, for example, the World Bank has a classification of countries by whether they're conflict affected or vulnerable, fragile countries. And the risk of measles and the outbreaks of measles are really concentrated in those countries that have conflict. And so, again, I'm just linking it to the work that MSF does, that conflict is obviously another huge challenge, and conflict is going on during COVID. We've talked a lot about COVID, but getting children vaccinated when you're in a situation of conflict within a country or in an area of a country is very, very challenging. And so those areas in particular we're really worried about.
Thank you so much. I guess we still have some minutes to answer one last question. I actually saw this question from when they registered for this webinar. The question is from John Carlos Santiago. Is there any possibility that we can obtain full invulnerability from measles? If yes, how?
I'm happy to make a start. I think full invulnerability, I think it means that we would actually perhaps eradicate measles. I'm not sure if that was the question. Before this pandemic, it looked like we were on track in several regions to really make progress in that direction. And the Western Pacific region has made tremendous progress in eliminating measles from countries. And elimination, it's jargon, but is on the track towards eradicating measles from the world. The Americas had made great progress, and they had a step backwards, and they're now getting back on track again, but very challenged by the pandemic. So we know we can make good progress. Let's figure out how we can recover from the situation we're in and get back on track with that. The European region is another one that's made good progress, and Southeast Asia. So nearly 2/3 of all the cases in the world are focused in the top 10 countries. They vary a little bit from year to year, but with the general progress that's being made in many countries, plus a focus on the countries that are most vulnerable, using different strategies, I think eventually we could, but it's not going to happen quickly. It's going to take time, and we've seen that with smallpox eradication, we've seen that with polio eradication. It takes many, many years to get there. So it's not going to happen next year or the year after, I can tell you that. Thanks.
Thank you so much, Dr. Crowcroft. And as much as we want to accommodate all questions, we come to the conclusion. So thank you so much, everyone, for those questions. Before we close this discussion, I'd like to ask our speakers for their final thoughts and takeaways from today's session of measles. Dr. Crowcroft, maybe we can start with you.
Thank you. So I think I'd like to refer to one of the questions we haven't addressed, but how do we get governments to give more attention to this issue? I would like to thank the attendees who've joined today because I think part of the solution to this problem is with you. Sorry to put it back on the audience, but it's all of us. We have to be talking about measles as an issue and raising it with our friends, our family, with anyone we can, because unless everyone, it has to be communities, healthcare workers, and governments. We all have to work together on this. It isn't one group. We had a recent UN meeting where we managed to get really high-level interest from several country ministers and deputy ministers of health from several countries to come along and talk about measles as an issue. So it is possible to get very high-level people interested and involved, and often it's a question of a conversation with the right person at the right time, and we can all really help push towards that. It's a kind of groundswell of this is an issue and we need to protect children. So I would ask everyone to think about measles, whenever you have an opportunity to talk about it, and to take away the messages from this webinar and take them to heart. Thank you.
Thank you for that powerful message, Dr. Crowcroft. Dr. Choi?
Yes, obviously what we want to emphasize is measles is a highly important public health issue. It's highly contagious. It can kill our young kids. So this is one point. And we do need the efforts of everyone in concert, may it be the government officials, the healthcare workers, NGOs, and even corporate, right? In terms of the promoting the awareness of the measles, and also to help out those who are in need. Bearing in mind that the measles vaccine is actually very effective and is an inexpensive way to prevent the disease. So it's down to us how to act to prevent the further occurrence of the disease.
Thank you so much, Dr. Choi. And lastly, Amy, your thoughts?
Measles is a preventable disease, but I think we cannot do it alone. So we need it needs a collaborative effort from different stakeholders in order to eradicate it. And I guess decision making needs also to be decentralized, to develop locally driven sustainable strategies for measles control and elimination.
Thank you. Thank you so much, Amy. And thank you all so much for those insights. I can talk all day with about this topic, but we only have an hour for this one. But thank you so much for your insights. And to everyone who joined us today, thank you for being here and for listening to our wonderful speakers and for sharing your questions as well. Very interesting. I hope we all remember not to forget other health topics under the shadow of COVID-19. Last but not the least, I think you can see it in your screen. We also look forward to seeing you at our next webinar. One is tuberculosis, an old and ongoing epidemic. That would be on the 12th of August, 2021. And then another one for methanol poisoning, the illegal brew that kills, happening on August 19th. If you haven't registered yet, the registration link should be in the chat box. So any comments and thoughts are welcome. I'd also like to remind everyone that we have a survey after this webinar. So hope you enjoy MSF Neglected Disease webinar series. Take care, everyone. Thank you and goodbye.